Well, a warm welcome to this talk. Now, I was just about to go to bed, actually, then I heard the rather interesting news that Robert Kennedy Jr., RFK, has been appointed to be head of the Department of Health and Human Services. Now, I'm going to go through what that means and a little bit about the Department of Health and Human Services in the United States, but I've just done a bit of a brainstorm of what this could mean. Now, Mr. Kennedy is interested in a lot of things that you and me are interested in, I know. So, for example, he could identify ultra-processed foods and toxic ingredients in ultra-processed foods. This could be done simply through food labelling, but getting rid of toxic ingredients in ultra-processed foods at source could be facilitated. Limiting toxic agricultural chemicals, herbicides and pesticides which go through into the food, and could be accounting for all sorts of ill health in the metabolic health crisis, which is an epidemic in the United States. We're not that brilliant in this country, but in the United States it's even worse, way, way worse. Now, it could promote full transparency of data. Now, I think all you really need to do is release the data. Then we've got all these scientists and statisticians and number crunchers just waiting to do that. They could analyse the data, and then truth will emerge from that data. When suppressed data or hidden data or classified data is released, all sorts of new analysis will be possible. And that will bring out truth, because I'm sure the data that's collected over the last few years is good, just that we're not allowed access to a lot of it. And then we'll know what has been going on. Promote full transparency of data, and that can lead to new research that can save untold lives in the United States, and from what's learnt in the United States, by extension, all around the world as well. This is really quite interesting possibilities. It can appoint rigorous and honest scientists and doctors on merit. You know, here's a good idea. Why don't we promote the best doctors and scientists and data analysts and researchers and functional scientists, and based on the ones that are best at doing the job, not the ones that have just come from a particular role or are likely to go back into a particular role. Get rid of this revolving door. Regulate information, getting rid of, we want complete freedom of information and transparency, but we want to get rid of the disinformation and the misinformation, which is sometimes malicious. We can promote peer-reviewed research and analysis, independent, proper peer-reviewed systems, and that can include government decisions as well. Use released data to audit the past. So all the things that have gone in the past few years, the data is there. It could be audited. And that will tell us what we've done right, what we've done wrong over the past few years and in a much wider context. Promote research based on clinical need and merit, not based on what's likely to make a lot of money. Promote research based on what's going to help people, what's going to save lives, what's going to reduce human pain, what's going to reduce suffering, what's going to help the next generation, what's going to make our children healthier. Research can be done based on those criteria, not on profit, on making money. We could include, for example, repurposed drugs, nutraceuticals. You know, we know all sorts of foods that are remarkably good for health. These can be promoted, they can be made cheaply, they can be manufactured, they can be produced in farms more cheaply. We can subsidise the right farms to produce the right kind of food. So many things can be done to revolutionise health. Natural, low-cost solutions can be used, rather than immediately jumping to high-tech pharmaceutical options, while all the time realising that pharmaceutical options can be life-saving if used in the right situation. Of course, no one's ever saying that pharmaceuticals aren't brilliant. They're absolutely wonderful. I've used drugs all my life. They're fantastic. But we need to use the right drug in the right situation at the right time. Give the right drug at the right dose to the right patient via the right route at the right time. That needs to be done, but considering lifestyle measures and other things which don't necessarily make a lot of money for certain individuals. So this can be optimized. High quality, low cost food can be provided to the entire nation if the political will is there. So let's just run through briefly what has happened. So So announced as head of the Secretary for the Department of Health and Human Services. He's going to be the Secretary. Now, I understand this will need to be approved, but I'm optimistic that the Senate, I'm not quite sure the approval system, if I'm in the States, do forgive my ignorance. I think the Senate has to approve this, but I think it probably will, which is pretty good news. This is what President Trump said. Thrilled to announce Robert F. Kennedy Jr. as the United States Secretary of Health and Human Services. Now, I'll just show you what this does encompass. Here we have it here. So we see, for example, Centers for Disease Control and Prevention. This is the CDC. We also see it's the Food and Drug Administration. All of these things are included in this umbrella organisation. National Institutes of Health. And quite a few organisations I wasn't that familiar with, or not familiar with at all, to be quite honest, are going to fall under the general heading of this department. So wide-ranging potential to do immense amounts of good for an entire nation and by extension the whole world, I am convinced. Let's go on. For too long, Mr. Trump says, Americans have been crushed, strong word, by the industrial food complex, yep, and drug companies who have engaged in deception, according to President Trump. Deception, according to Mr. Trump. Misinformation and disinformation when it comes to public health. I agree. Mr. Kennedy will restore these agencies to the traditions of gold standard scientific research. We have a proud tradition of scientific research. We know how to do this. We understand the scientific method. We just have to do it. We stand on the shoulders of giants. We have proud, brilliant traditions. All we've got to do is return to them. Gold standard scientific research. We have the scientists. We have the equipment. We can do this. We can make it gold standard again. And beacons of transparency. Release the data. Let's see what's been going on. To end the chronic disease epidemic, and make no mistake, there is a chronic disease epidemic. And somewhat of an acute disease epidemic, I think, in the States, it has to be said as well. And we're not that much better in this country and other places, Canada, Australia, all around the world. Once this is sorted out in America, people will learn how this can be done. And I believe you can save money and make the diet healthier at the same time by cutting out the vested interest or reducing the vested interest. So chronic disease epidemic, massive problem. Acute disease as well. And this doesn't even start to mention the preventative medicine. So many diseases could be prevented. How many cancers and things could be prevented in the future? Now, who knows? There might be money for Professor Dalglish's preparation to boost the immune system, or Professor Clancy's preparation to increase mucosal immunity. All these low-cost things can be done. We have the science, we know what to do, we just need the political will to do it. Department of Health and to make America great and healthy again, absolutely, and hopefully the rest of the world as well. We could do being much healthier than we are in the UK. Department of Health and Human Services, as we said, Food and Drug Administration, Centers for Disease Control and Prevention, National Institutes of Health, Medicare and Medicare services. All these are fall under this umbrella, and all these other things I've mentioned here as well that you'll be much more familiar with if you are living in the States. Mr. Kennedy, Make America Healthy Again, of course, is has been involved in lawsuits against major pesticide and pharmaceutical companies, so he knows how the system works. And adding on to that, I've seen some really distressing videos that he's made on the appalling state of animal welfare in the United States. This is just not acceptable in a civilized country. Animals, yes, we have to eat them. In my view, we're certainly allowed to eat them, but they have to live as good a life as possible and be humanely killed. And at the moment, this is not happening, and it's not acceptable. We have to improve animal welfare, and that will improve. And animals are not entities, they're living things. And I know he's worked on this in the past, and hopefully Mr. Kennedy will be aware of this and implement people that will introduce good animal welfare. Perhaps smaller family-run farms rather than industrial complexes where our animals can be treated like entities rather than sentient beings. He knows how it works. He's pushed for tighter regulations around ingredients of food and many other things that we've talked about. That was just my brainstormed list. Just jotted that down in a few minutes before the video. But interesting possibilities and exciting possibilities, and the whole world will benefit, I believe, from the data that can be released. So if you're watching in the UK, good night. If you're watching in the United States, good afternoon. And if you're watching in Australia, pretty soon, good morning. But for now, thank you for watching. Needless to say, we'll be following this with great interest. And I meant to stop, but the opportunities for research are huge. We can compare the way it is now, the effect of the interventions, and look at how much better things are, if indeed they are better, after the interventions. But based on everything we understand about medicine and healthcare and nutrition and ecology, they will be better. Something to look forward to. Something to have hope in. From a UK which is currently lacking in hope. Talk soon. Thank you for watching.